Hello and good afternoon, everyone. My name is Muhammad Al Ibaid. I'm an anesthesia specialist from Sudan, currently working in Galway University Hospital as an anesthetic registrar in the west of Ireland. Today, I'm going to speak about addressing burnout and mental health stigma among healthcare workers in humanitarian setting, the experience from Sudan. So burnout is a common problem worldwide. A survey that was done comparing physicians for normal general US population showing that physicians have a higher incidence of burnout of 37 compare of 27.8%, about 10% higher, and showing that physicians are more dissatisfied with the work-life balance with 40% comparing to 23.2% with the general population. And another scope review showing that burnout is as high as 50% between physicians in Western countries. And if we looked at the African countries, this review showing that a very high incidence of burnout between physicians, and this study was done during the COVID and after that. And if we can see the number here, we will see that 68 to 72% of burnout. And if we looked more into the burnout incidents in war and African countries, we will see this study, which is an observational study done in Ukraine during the war, showing an incidence of 49.1%. And if we look at Africa, this study was done in Libya during the pandemic and the civil war, showing 67.1%. And lastly, if we looked at one of the studies that was done in Sudan, we will see that burnout is as high as 86.1%. And this will show that burnout is high, especially in the conflict zone where violence is widespread and violation of the human rights are common. And these settings are extreme, and usually healthcare worker will face a severe resource shortage in addition to the direct exposure to the trauma and the risk for their life, and this will increase the incidence of burnout as well. And why do we care? Why we are speaking and talking about burnout and discussing the burnout? Because, as you know, it will have negative consequences on personal life. In addition to that, it can negatively impact the patient care, increase the risk of medical error, reduce the job satisfaction, and contribute to the high staff turnover. And the data from the Commonwealth Fund will show, as in here, that except to the US and the Australia, primary care physicians who experience burnout are more likely to stop seeing patients in the future. And in the graph, the orange column will show the burnout patient comparing to the burnout physicians comparing to non-burnout physicians. And if we switch the gears now and we start to explore the current situation of the humanitarian response, we will see, as you will all know, that there is an increase in the insecurities in the food in the last few years. There is trending up, and there is trending up in the conflict as well. And looking again more in detail in the data of the emergency watch list, we will see that there is increase in the displacement worldwide. And if we look at the response, and this is the data from the humanitarian action, you will see there is a decreased fund as well as increased risk to be killed if you are working in the humanitarian setting. And this is mean that the physicians are already burnout. It's worldwide. There is increase in the response. There is increase in the humanitarian needs. However, there are multiple factors that will make everything more difficult and risky. So in response, we explored the fast well-being, which is a one-day workshop designed to promote personal, professional well-being and reduce the burnout. We explored the participant experience of the fast well-being in Sudan during in the context of the war, and we tried to see if it is applicable to use it in other conflict zones. So we collected the data and we used a mixed method, which has both two different quantitative methods in addition to a qualitative interview. And if you can see here from the result that showed there is reduced or decrease in the stigmata scale of receiving psychological help, and you can also see here that there is increase in the score of the general help seek questionnaire. So our result suggests that this kind of training is both relevant and impactful, and people and healthcare provider can get a value from well structured training program in the well-being. However, the course was originally designed for chronic stress, and we think that in the future we can add a module in acute stress as well as post-traumatic disorders. Thank you very much for your time, and hopefully you will enjoy the rest of the day.